In this video, I'm going to be talking about implementation station. What about it? After you might have done assessment, planning, the next on apply implementation station where you will give this patient medications that is prescribed. In this video, I'm going to be demonstrating it appropriately. Also, I'm going to be sharing top tips towards the end of the video, top tips that will help you to ace this station at ease. Also, the common errors that could make candidates to fail these stations. These are what is going to be discussed in this video. So I would want you to stick to the end of the video. So hit on the subscribe button, drop a lovely comment for me. Tell me the next OSCE station you want me to do, and I'm going to do that. All right, let's dive directly into that. As I approach my scene, I see my scene is safe, nothing to harm me or my patient. I provide privacy by pulling the nearby curtain. I go ahead and perform my hand hygiene, following the 7 steps of WHO standard. Ample amount of gel to my palm. I rub palm to palm, right palm over left dorsum, vice versa. Fingers interlaced, fingers interlocked, vice versa. Rotational rubbing of the thumb, vice versa. Rotational rubbing of the finger close to my palm, vice versa. Rotational rubbing of my wrist, vice versa. My hands are clean. I will allow to air dry for 30 seconds as I approach my patient. Hello, I'm Kenny, one of the nurses that will be looking after you today. How are you? All right, the reason why I'm here is to administer your due medication for 1200 hours. All right, is it a convenient time, please? Okay, thank you very much. Before we proceed, could you please confirm your full name and date of birth while I double check with my paperwork as well as against your wristband, please? All right, I can see Janet James. Janet James, all right. Your date of birth is 01/01/1992. 01/01/1992. Your hospital number is 1234567. 1234567. Fantastic. Assessor, I can confirm I am with the right patient. All right. How may I address you, please? Okay, Janet is fine. All right. Right. Are you allergic to anything at all? Okay, it is properly documented here that you have no known allergy. All right. So I am happy to proceed. Okay, before I go to prepare the medication, is it okay to take you through your medication record chart, please? All right, Janet, is it okay to take you through your medication record chart, please? All right, thank you. I have the hospital MAR chart for Janet James. The date of birth 01/01/1992. The hospital number is 1234567. The height is 1.6 meter. The weight is 72. The body mass index is not stated. The name of the prescriber is Dr. Tolu. The GMC number is 1234567. The signature is properly appended. The blip number is 1234. All right. So under the page where the details of the person administering the medication is, which is me, I'm going to be coming back to document appropriately after administration of the medication. I move on to the alert under allergies. Janet is not having any known allergy. All right. And no known allergy is ticked for the patient. All right. So under medication risk factors, there is no medication risk factor tick for Janet. I move on to the next page. I still have the hospital MAR chart for Janet James. The date of birth 01/01/1992. The rest of the information on this page is as the same as the previous. I've read and understood the code. I'll be coming to use if need be. I move on to once only medicine. Under once only medicine, there is no once only medicine prescribed for Janet. I move on to the next page. I have hospital MAR chart for Janet James still. 01/01/1992 is the date of birth, and the rest of the information on this page is as the same as the previous. Under prescribed oxygen, Janet is not a known CO2 retainer, so the box no is ticked. All right, and I move on to antimicrobials. Under antimicrobials, flucloxacillin is the first medication that is prescribed for Janet. and the date is today. The dose is 500 milligram. The frequency is QDS. The route is per hora. The duration is 7 days. The start date is today. The finish date is +6 days. Culture has been sent. The prescriber's signature and blip is properly documented, and the name is duly printed. It is a valid and legible prescription. It is due at my time, which is 1200 hour. I am happy to administer. Alright, Janet, flucloxacillin is an antimicrobial. It is used to prevent wound infection. Some of the likely side effects which you may or may not manifest includes and not limited to nausea, vomiting, or headache. Are you still happy for me to continue? Alright, thank you very much. I'm not going to be signing that medication. I will do that as soon as Janet has taken the medication. Moving on to the next page, I have hospital mark chart for Janet James. The date of birth is 01/01/1992. The rest of information on this page is as the same as the previous. There is no other antimicrobial prescribed for Janet. I move on to the regular medicine. Under regular medicine, there is no regular medicine prescribed for Janet. I move on to the next page. I have hospital mark chart for Janet James. The date of birth is 01/01/1992. Every other information is as the same as previous. Under as required medicine, the medication is paracetamol. The date is today. The dose is 1 gram. The frequency is 4 to 6 hours. The route is per hora. The duration is left open. The time is left open. The start date is not stated. The finish date is not stated. The prescriber's signature and blip is properly documented, and the name of the prescriber is properly documented. It is a valid and legible prescription. However, it is as required medicine. That is why some of the details are missing. Alright, Janet, if I may ask, are you still in any form of pain, please? Oh, alright, you are in pain. On the scale of 0 to 10, 0 being the least and 10 being the highest, could you please rate your pain for me? Oh, that's quite high. Alright, so sorry to hear that. Okay, I'm happy to administer paracetamol to you because your weight is above 50 kilogram and you don't have any allergic reaction to paracetamol. Alright, I will not be signing that now. I will be coming back to sign that. Okay, so what paracetamol does is it's a pain relief, and some of the side effects you may or may likely not to manifest include and not limited to nausea, abdominal discomfort, or dizziness. Are you still happy for me to continue? All right, thank you very much. So I move on to the next page. I still have hospital mark chart for Janet James. The date of birth 01/01/1992. The rest of information on this page is as the same as previous. Under infusion, Janet is not on any infusion. Okay, so I move on to the omitted doses. Under omitted doses, if I will omit any medication, I will come here to properly document it. Alright, so here is the call bell, Janet. I will be stepping aside now to prepare your medication. Do press on the call bell if you need me. Is that okay? Alright, so I'll go ahead and perform my hand hygiene following the 7th step of WHO standard, stepping aside from my patient. Alright, so assessor, could you please confirm the medication cupboard is under lock and key and it will only be opened for the purpose of this medication administration, please? Alright, thank you very much. So I will go ahead now and validate my medication, comparing it with my prescription to be sure it's the same medication that is prescribed. So I have on my hand flucloxacillin. Flucloxacillin 500 milligram is the stock dose. It is not expired. The expiration date is February 2026. Comparing that with the prescription, I could see is the same flucloxacillin that is prescribed, also in 500 milligram. It does mean that I will be popping one capsule of the medication to my medicine pot. So, prior to every drug administration, the 6 rights of medications need to be ensured, which is the right patient, the right medication, the right dose, the right route, the right time and date, validity of the prescription, and the right documentation. I have all of the 6 rights and I'm happy to proceed. So in aseptic manner, I'm going to be popping my medication onto the cover of the medicine pot, making sure my hand does not contact it. So I will carefully transfer that in an aseptic manner to the medicine pot. All right, then I'll keep that aside and cover the medicine bottle, set it aside. So I have on my hand paracetamol. Paracetamol, this is 500 milligram of paracetamol. It is not expired. The expiration date is February 2026, still in date. Comparing that with my prescription, I have the same paracetamol prescribed. 1 gram is the required dose. It does mean I'm going to be popping 2 tablets from the medicine pot in an aseptic manner, making sure my hand does not directly contact the medicine. And I will pop right carefully into the medicine pot. I will set that aside and I will close the medicine bottle and set it aside. So I'm done preparing my medication now. So I'll go ahead and perform my hand hygiene following the 7 steps of WHO standard as I go back to my patient. Right, Janet, I am back. Are you still happy for us to continue? All right, thank you very much. Before we proceed, could you please quickly confirm your full name and date of birth while I double check with my paperwork as well as against your wristband again, please? Okay, so I still have Janet James. Janet James. Your date of birth is 0101-1992, 0101-1992. And your hospital number is 1234567, 1234567. So, are you allergic to anything at all? Okay, it's still properly documented that you have no known allergy. So, assessor, I can still confirm I am with the right patient. All right, Janet, I have your medications here with me. So, could you please confirm with me if you have any difficulty swallowing? Okay, thank you. Are you in any form of nausea at the moment? I don't have any nausea at the moment, so I'm glad to hear that. Okay, do you want your medications together or separately? Oh, you want it together. Fantastic. Do you want it with water or squash or milk? Do you want it with water or squash? Okay, fantastic. Okay, you want it with water. All right. Do you want to take the water first or the medication first and the water follows it? Or you want the water first? So here is the water. Could you please swallow? Good. And here is the medication. Could you please swallow? All right, good. All right, could you please confirm you have swallowed the medication by opening your mouth? Oh, fantastic. So, assessor, I can confirm Janet has taken the medications. Okay, so I'm going to be stepping aside now, Janet, to properly document what I've done. and I'm going to be monitoring you for the next 30 minutes for any side effects. And after I might have gone, you can make use of call bell anytime, and we'll be here to attend to you. Is that okay? So I'll go ahead and perform my hand hygiene following the 7 steps of WHO standard. So I'll go ahead now and append my signature correctly. Yeah, in those places I asterisk initially. All right, Janet, I'm back. Are you still comfortable? All right. Okay. So, like I said earlier, do press on the buzzer if you need us, and I'll be here to attend to you or any member of the team. Is that okay? All right. Thank you very much. So I'm going to lock the cupboard now and return the key to a place of safety. Yeah. Then I'll perform my hand hygiene following the 7 steps of WHO standard. So thank you so much, viewers. That brings us to the end of the implementation station. I hope you've learned something. Yeah, in my subsequent videos, just drop with us whatever the video you want to watch next, and I'm going to try my best to bring it to us. Do not forget to subscribe to this new channel and make it grow. Drop comments and do like the video. It means a lot to us. Yeah, top tip about this station is it is important you do your ID check twice. For every medication administration station, it is important you do ID check twice. All right. And it is important to properly append your signature against the time you are administering the medication. Please note, if it is to be community scenario, you are going to be appending your signature, the date and time. All right, that's one of the differences from the hospital march chart. Okay, for community march chart, you append your signature, the date and time. But for hospital, you're going to just append your signature. All right. Also, the cease right of medication must be omitted from this station. Otherwise, it could be critical. Okay, so have that at the back of your mind. Very importantly, you must validate your medication. If you don't mention expiry date, it could be critical. Okay. Also, you need to watch out for the trap. With traps. Yeah, you need to watch out for those traps. What are these traps? In case of a patient that is having if you are administering for a patient who is having blood pressure related cases, okay, you need to check and know what the blood pressure is before you go ahead and administer blood pressure medication. For a patient who is having a blood pressure of below 120/80 millimeter of mercury, please code the medication. Yeah, in my next video, I'm going to be talking about the medication coding. I don't want this video to be too lengthy. All right, code the medication. If you are given bisoprolol in case of like a patient who is having arrhythmia, bisoprolol as an anti-arrhythmia now, you need to check for the heart rate of this patient. Heart rate of below 60 beats per minute should be documented and escalated. Code it. Do not give that medication. And for paracetamol, a patient that is weighing less than 50 kilograms should not be administered paracetamol. Okay, these are the common trap. Also, for a patient who is allergic to penicillin and penicillin derivative. Yeah, what are penicillin derivatives? Amoxicillin, co-amoxiclav. Yeah, these medications, they belong to even flucloxacillin. Yeah, and you may, but when it will now still be critical if you see azithromycin or erythromycin and you say you're not going to give because they belong to the class of penicillin. It's going to be a critical fail because these other medications that I mentioned, they are not penicillin derivative. All right, so you need to watch out for the allergy of this patient. Finally, on that note, it is likely you are administering 3 medications or less in every implementation station. By the time you are about to administer the 4th medication, something should give you a signal that something is wrong somewhere. It's either you are falling into the trap or you did not take note of this initially. It's worth mentioning that you need to carry your patients along, read the medication with them, take them through the medication chart. It belongs to them. So they need to be aware of whatever they are taking. Also, it is imperative you mention the indication of any medication at all, and let the patient be aware of the side effects. Are they willing for you? Are they happy for you to continue with the administration of the medication? You need to be sure and ask them. All right. So here are some of the things I think could be like a common error for this station. I hope you've learned something. Till I come your way in my subsequent videos, keep practicing OSCE.